You're out on a typical morning walk. Your dog stops at their usual patch of grass, does their business, and leaves behind a puddle that is distinctly pink, red, or dark brown. For most pet owners, the immediate assumption is a worst-case scenario, like internal bleeding or a terminal diagnosis. But that red tint is a shared physical symptom for dozens of vastly different medical conditions, ranging from manageable infections to acute emergencies. The exact shade of the puddle, whether it's a light rose or a dark rust, provides no reliable information about how sick the dog actually is. Identifying the actual cause requires looking past the puddle on the grass and determining which specific biological compound is dyeing the urine red. The first culprit is hematuria. This is the presence of whole, intact red blood cells leaking directly into the urinary tract. This functions as a localized plumbing problem. Somewhere between the kidneys and the urethra, a cystical structure is actively bleeding. Frequently, this structural bleeding comes from everyday sources, like a standard urinary tract infection or the abrasive edges of crystals and stones scraping against the bladder wall. In older, sexually intact male dogs, a benign enlarged prostate is another highly common source of this localized bleeding. While it is a common fear, lower urinary tract cancer remains a rare possibility within this category. Hematuria signifies physical bleeding. However, it is only the first of 3 possible causes, and the next 2 do not involve whole blood at all. The second red flag is hemoglobinuria. In these cases, the red color comes from the protein hemoglobin rather than whole cells. This happens when red blood cells are actively destroyed within the bloodstream. They break apart, leaving behind free-floating hemoglobin that the kidneys filter out and dump into the urine. This indicates a severe systemic crisis. A major bacterial infection like leptospirosis or an autoimmune disease can cause the dog's body to attack its own blood supply. Common household toxins trigger this same cellular breakdown. Ingesting rodent poison, human acetaminophen pills, or a large amount of onions can destroy red blood cells from the inside. Hemoglobinuria means the red tint is coming from a systemic attack or toxin exposure occurring within the circulatory system itself. The third and final cause is myoglobinuria. This red or brown tint comes from myoglobin, a protein found strictly inside muscle tissue. Myoglobin only leaks into the bloodstream when a dog's muscle tissue is severely damaged or actively breaking down. The triggers for this breakdown are extreme. Severe physical overexertion, traumatic injury, or critical heat stroke cause the muscles to deteriorate, flooding the kidneys with myoglobin. A red puddle on the grass is often a sign of catastrophic muscle death rather than active bleeding. To the naked eye, hematuria, hemoglobinuria, and myoglobinuria can look completely identical. Because visual identification is impossible, a wait-and-see approach or using leftover human antibiotics can be extremely dangerous. This clinical flowchart shows how veterinarians systematically trace the source of that red tint, eliminating these vastly different threats step by step. Navigating these diagnostic branches requires a professional toolkit. Urinalysis, blood profiles, and ultrasounds are all necessary, usually within a tight 24-hour window. While the clinic handles the testing, the pet owner can control one critical variable, safely collecting a clean urine sample for the vet. Use a thoroughly washed flat takeaway tray or fashion a shallow bowl out of tinfoil. Take the dog out on a lead, wait for them to start urinating, and calmly place the tray into the midstream. The sight of red urine is alarming, but providing a clean sample allows a veterinarian to pinpoint the trigger and begin targeted treatment immediately.